Approaching tension and chronic neck pain for patterns that are referring up behind the eye is complicated and layered. Get your favorite product, get your client, get yourself ready, and let's go. This video has a part 1, which you don't have to watch before you watch this one, but I recommend it because it dives into some of the more broader aspects of being human that contribute to neck pain. For this video, I'm bringing the work down into the shoulder, demonstrating some effective sideline techniques, and talking through how to approach stubborn neck pain, possible disc herniations, and rigid holding patterns that we can approach safely. So I've got my left hand underneath my client's right shoulder, and I'm using my right hand to manipulate what her arm does, and this is helping me compress into the upper traps, the levator scapula, and the rhomboids, all which contribute to neck function and mobility. Because of the holding patterns and trigger point referral patterns that live here and affect the neck, by using my right hand to move the arm around and compressing in with the fingers of my left hand, I'm affecting the connection, the movement, and the unconscious protection that tends to live here. I recommend hanging out with this approach for a while because even though when somebody experiences neck pain, if there is something deeper going on like a herniation or a stenosis, it can feel like they want work directly in that area, but that isn't always the best move. And bringing awareness away from the immediate dysfunction into secondary holding patterns is, if nothing else, a supportive method to decrease pain and bring back functionality. So muscles like the upper and middle traps, the levator scapula, the splenius, capitis, and cervicis, and the deeper muscles like the semispinalis and the multifidi, those are all muscles that reach from the upper thoracic area into the neck. So to avoid digging into a herniation, which we do not want to do, accessing these muscles through shoulder movement as opposed to neck movement plays a role in the overall functionality. So again, I'm not digging into a primary pain point, but this is where soft tissue manipulation shines. Look at it this way. If stimulating a motor unit engages the entirety of that muscle fiber, then we want to come from the opposite direction. By changing the sensory input, we are modulating the neural drive to the entire muscle. We're essentially giving the nervous system permission to turn down the alarm. Like for all of these techniques that I'm demoing, when I have my client move her shoulder, either lifting her arm up off the table or pushing her arm down towards her feet, coupled with the stimulation of external pressure, and then having her relax after those movements sends a response to the nervous system to ask the entire muscle to let go. After a quick but gentle reconnection with the neck, I want to bring my work back down and start to address any points that seem pertinent for my client. Commonly for neck dysfunction, this is found at the superior angle of the scapula, where the levator scapula and the upper traps cross paths, but stay in communication with your client and find out where they're holding their tension. I'm about to transition to bringing my client into more of a sideline position, but I want to remember and I want to remind you that we serve as kind of a tour guide. So before I switch things up, I want to direct my client's attention away from her neck and into her shoulder. This is like guiding them through an art museum and giving them some lessons on how paint was created before they see the Mona Lisa. Okay, maybe not quite like that, but the muscles of the back are connected to the neck, and the muscles at the front of the shoulder are also connected to the back. Therefore, the muscles of the front of the shoulder are connected to the neck. So by supporting the back of the shoulder and compressing down into the front of the shoulder in combination with a big deep breath, I'm connecting the dots for my client about how all of this work is going to help with what's going on for her neck. Before we go full side lying, I'm going to pull her into kind of a pseudo side lying. And before I do that, I'm going to magically transport myself to the other side of the table. I'm reaching across, holding her arm and making sure she's letting go. And as I pull her arm towards her opposite hip, I'm asking her to let her body feel heavy. So if I were to let go, she would drop back down to the table. Once I'm holding the weight of her shoulder and her torso in my hands, I'm bracing my own body mechanics with my thighs onto the side of the table that you can't see right now, and I'm using the fingertips of both hands to outline the medial border of the scapula. This does a bunch of things. Number one, it pulls the scapula away from the spine, elongating a lot of those upper back muscles. Number two, it addresses the attachment sites of a lot of important muscles, including the entirety of the trapezius, the rhomboids, the serratus posterior superior, and the levator scapula. Number three, it allows me to pull the shoulder down away from the ear without directly manipulating the neck. And number four, it allows my client's head to lay heavy in a rested position, reducing the strain that can happen when we directly affect the neck. A disc herniation can happen for a lot of reasons, but if your client happens to also be young and pretty physically active and able to handle more aggressive work, go ahead and have them press their arm down towards their opposite hip. This is going to engage the muscles in the front of the shoulder, which is going to ask the muscles in the back to let go. And when that happens, creating extra friction right at the attachment sites is like a 1-2 punch, in the best way, of course. I've finally got my client full side lying, and somehow magically she has a pillow under her head to keep her neck neutral. And this position gives these muscles a whole different perspective about how to receive this work. Like right here, I'm sinking down through the upper traps to get into the supraspinatus. And while the supraspinatus is a shoulder abductor, so considered one of the rotator cuff muscles, I'm also, like I said, sinking through the upper traps. And the upper traps attach all along the spine of the scapula and the lateral portion of the clavicle and go all the way up to the cervical spine and into the base of the skull. So as I'm tricking my client to thinking that I'm working on her shoulder, I am also definitely working on her neck. Just kidding, I'm not trying to trick my client, but if I do explain why I'm working into her shoulder and she came to me with a neck problem, that's going to be really helpful. So I've got my left hand right now placed on her shoulder and I'm guiding it so that I'm pinning and stretching the upper traps. My left hand is pulling the shoulder up a little bit as my client takes a deep breath in, and as she exhales, my left hand on that shoulder is going to guide it down away from her ear and allow the work that I'm doing with my right hand to sink in a little bit deeper and open up and elongate those fibers of the upper traps down into the levator scapula and into the supraspinatus. While I demo that this can also be done with knuckles or a forearm, I want to point out that this work is important for neck dysfunction because when the upper traps are over-contracted, which happens to most of us pretty much most of the time, over long periods of time and possibly in conjunction with other daily movements, this is going to affect the way that the vertebrae in the cervical spine sit. So if your right upper traps are contracting way more than your left, that hypertonicity will eventually pull those bones in a slightly shifted away from neutral position, which leaves those discs vulnerable for herniation. While I switch my position, because switching positions is going to change the way these muscles feel, even if you're doing the same work, I want to explain that having tension in the upper traps is not a bad thing. As a matter of fact, strong shoulder and neck muscles can be really beneficial. But there's a slippery slope between good tension and hypertension, and this video is directed towards the latter. So at this point, I've got my client's right arm draped over my right arm, and I'm using both of my fingers to sink down through the upper traps and into the supraspinatus again, affecting the muscles that go up into the neck. Like I mentioned before, switching positions is going to change the way a technique feels to a muscle. So even though I've already worked into these muscles from different directions, coming at it from this angle is going to feel different to the client. Bonus pro tip, I'm also able to do more in this direction that I wasn't able to do before. So my right hand is supporting the front of the shoulder, but it's also guiding the scapula to fall back and down towards the table. This is going to soften the rhomboids, and this technique is amazing for the rhomboids, but it also softens the serratus posterior superior, which, if that's holding tension, clamps down on the paraspinals, creating a domino effect of restriction traveling up the back of the neck into the skull. And also, while I'm really starting to get into the medial border and the superior angle and all the upper back and neck muscles that grab onto this bone, I want to point out that this work is not just about decreasing hypertonicity that might contribute to a less than symmetrical cervical spine. If there is already a bulging disc, or even some kind of arthritis or other structural neck dysfunction, muscle guarding is real. I'm using my right arm to bring her right arm into shoulder flexion. And this passive range of motion is amazing, but at the same time, I'm talking to her about letting her jaw go, letting her tongue relax inside of her mouth, letting her fingers go, and even releasing the grip on her knees and her toes. Because dang if we don't all need that reminder. So while I'm working into the neck here, the pressure underneath my left thumb is very light, and I'm using my right hand to manipulate the shoulder, reminding the distal aspects of these muscles to begin to let go. It's important to remind your client of this perspective while you're working, because while I would love to be able to heal a herniated disc, managing guarding patterns that prevent things from getting worse is noble and noteworthy. If you've made it this far into the video, I've got some bonus tips for you about how to manipulate the scapula with a little extra finesse. I've got my left arm under my client's right arm, and I'm grabbing the inferior angle of the scapula. As I do this, I'm also pressing into those lower fibers of the rhomboids and starting to access the lats and the teres major and minor, but I'm simultaneously staying focused into the superior angle and all of those muscles that travel up into the neck. This is an incredible distraction technique. The work with my right hand is still trying to mitigate all of that tension, but the work with my left hand is starting to draw her attention away from her neck and give her something else to think about. The other cool thing about this technique is that my client's right hand is resting at her low back, which means that her humerus is medially rotated, which is pulling the scapula into a different position, which is creating a slight twist in the muscles of the upper shoulder. A change in the position of the shoulder and the direction of the pressure into these muscles is going to give you the ability to access different aspects of all of these fibers and make your work more complete. And that, my dear friends, is half the battle. When we are managing something like a herniation or an issue or a dysfunction that is out of our scope of practice, we are quite capable of managing protective muscle patterns. But if we don't do that thoroughly, then this healthcare team that is hopefully working with your client is kind of fighting a losing battle. We are part of a bigger chain of events. And here in this moment with this client, if I can help release some tension and decrease that stress load, I've contributed my part, and I'm feeling pretty good about that.